There are several ways to determine if you are ovulating. Basal body temperature, BBT, charting. This involves taking your temperature every morning before getting out of bed and tracking it over time. A noticeable increase in temperature can indicate ovulation. Ovulation predictor kits, OPKs. These are kits that detect the surge of luteinizing hormone, LH, in your urine, which indicates ovulation is about to occur. Cervical mucus monitoring. The consistency and quantity of cervical mucus changes throughout the menstrual cycle and can indicate when ovulation is occurring. Pelvic examination. A doctor or gynecologist can perform a pelvic examination to check the position and texture of your cervix, which can indicate if you are ovulating. Ultrasound. An ultrasound can be used to monitor the growth of follicles, which can indicate ovulation is about to occur. It is important to note that every person's cycle is different and these methods may not work for everyone. It may be helpful to use multiple methods to confirm ovulation. If you are trying to conceive, it is a good idea to consult a doctor or fertility specialist for personalized advice.